Anyway, so to introduce, our next speaker is Professor Gillian Laying from NICE, the National Institute. Oh, God. So I always get it wrong. National Institute for Health and Care Excellence. And basically, Gillian's going to talk about, how we unlock the, the potential of integration. So how we find the key to unlock that potential, which has been one of the long-running challenges in terms of health and social care, and also providing some information on how NICE can work with providers and with the sector to improve standards of care. So, Gillian, over to you.
Thanks very much. Good afternoon, everybody. Somebody told me that the lights up here were really bright, but they really are bright. I could do one of those American baseball caps so I can see you. I was going to ask how many people have heard of NICE, but I don't know that I could see the answer. Oh yeah, I can see a few hands. That's a good place to start from. And most people will associate NICE, we know from our surveys that we do, with health, perhaps specifically with some of the drug appraisals that we do. They tend to be the things that reach the front page of the Daily Mail. We do actually now have a broad remit. We produce guidance, evidence-based products, a web portal for evidence across a range of health and public health topics, looking at really what works, what provides best care and best value for money. But we do now have a new responsibility for social care, which was set out in the Health and Social Care Act published last year. And it gives us a formal responsibility for developing both quality standards and guidance for social care across England. We thought that people might ask, why had we been chosen to take on this role for social care, bearing in mind we're perhaps most associated with health. We think these are the reasons. We think we have a good, credible track record in developing robust evidence-based guidance in healthcare, and that this gives us a great opportunity to integrate that work in healthcare across with social care recommendations as well. In fact, years ago, I used to lead on our clinical guidelines program, and it was sometimes really quite frustrating when we had to produce a set of recommendations for long-term conditions, usually, that stopped at the point where there would be an interface with social care. So I'm particularly pleased that we now have this remit that lets us extend into the social care field to produce a broader set of recommendations. People will also sometimes tell us that it's different in social care, that the evidence is different, there won't be trials, and I'm absolutely sure that they're right. But we do have that problem in quite a lot of the health guidance that we produce as well. In fact, we've produced a whole guideline where there is no formal published evidence. So what we will do, as we do for health, is to look at the whole portfolio of evidence, be it robust randomized controlled trials, be it case control studies, be it less formal types of evidence, and we'll look at the whole set of evidence and base the recommendations on the best available information, using consensus if needed. So I've talked about the Act referring to NICE producing guidance and standards for social care, and just to outline what I mean by those products. Basically, we start with the evidence. From that, we generate guidance. And long pieces of guidance, and I'm not talking here about drug appraisals, but long pieces of guidance represent a comprehensive set of recommendations for a particular condition or a service area. It makes it look as though it's easy here, doesn't it? We take the evidence and we produce the guidance, but as I said earlier, there's often incomplete evidence. We rely a lot on getting an appropriate expert group of people, patients and carers as well, together to produce those recommendations, and we have a consultation process. But what we do, the quality standards draw on guidance, and in essence what the quality standards process is a prioritisation mechanism where we look at a complete set of guidance recommendations and identify a set of concise, measurable statements that are designed to drive quality improvement. So they're very much about quality improvement and measurable statements. Going back to what we're doing in social care specifically, we have already published 2 quality standards. You might have seen them. They came out in April. And these were based on guidance that was already available. Some of it was NICE guidance, some of it was from Sky. These covered people living with dementia and the health and well-being of looked after children and young people. And I'll illustrate one of those in a moment. So that's what we've started with, but we also have a portfolio of 10 new topics that we've been referred by the Department of Health. I'll show you what those are in a moment. And the Department of Health has also just recently closed a consultation on a longer set of potential future topics. There were 270 responses to this consultation, so a lot of interest, which was really great to see, because it's important that we get the right topics at this point so that the programme is useful at the end of the day. Most of those responses were agreeing with the proposals that were there, clearly some suggestions around shaping them, and also some new ideas that we didn't have in the original list. So it's quite a big task to go through all these responses, because 270 responses equals an awful lot more individual comments. But what we will do is sift through all of those and prioritise a list that will represent the next tranche of topics that we'll work on, and hopefully that will be finalised sometime in the autumn. In terms of the things that are now on the programme for the next stage of work, you'll see these topics on our website. The 3 at the top say guidance is available, which means that we can go straight ahead and develop a quality standard. The topics underneath will require new guidance to be developed, hence the longer time frames, because it takes us usually 18 months to 2 years to develop a piece of guidance. I think these illustrate a good breadth of topics. Some of them are clearly about that interface between health and social care, the transition between health and social care. The medicines management in care homes will very much help us bridge that gap. But what you don't see on this list are also all the topics that are in our health-related programmes. And there, particularly, as I said before, for long-term conditions, we've been mapping out where we now in future need to provide a broader set of recommendations that cover that interface with social care. A good example recently of doing that was with the rehabilitation after stroke guideline, which at one point would not have covered social care, but it has in the final guideline that we've just published. These are quite high level, these descriptions of the topics, as you'll probably have spotted. So there's a lot of work that's been going on in conjunction with Sky, who's managing this work through the Collaborating Centre, to first of all run exploratory workshops to help us understand what the key issues are in these topics before we finalise the scope of the guidance. So I've been talking about the interface between health and social care, but we also have an interface with our public health programme. And within the quality standards, we're very sensitive to those interfaces, to making sure we're mapping out where everything overlaps to provide a coherent set of information for the end users. I said I'd give you an example of what the published dementia standard looked like. We did, in fact, publish a health-related standard for dementia a while ago. This new one, published in April, is specifically in relation to the social care elements. As I say, it wasn't just drawn on NICE guidance, it was drawn on an accredited guide from Sky. Have many people here seen it? If you remember, I said there's a prioritisation process that we go through, which takes all the recommendations about what good care looks like to identify those key things that will focus on quality improvement. And it's quite a difficult thing to do because there is inevitably going to be a focus on those prioritised statements, and we need to make sure that they are things that can only happen if actually you've got the whole package of care right. So in the end, for this set of quality standard, we ended up with 10 statements. It's usually around about 6 to 10. And this slide, if you can see it from the back, gives you the headlines of what those statements are. Choice and control in decisions, leisure activities. But underpinning each of those statements on the website is then a lot more detail about what that means in practice, supportive tools that you might have, and measures for going out and trying to measure progress against the quality standard. That's one area where I'm aware that there's historically a difference in what happens in social care compared with health, where health are used to doing audits of care. I think I'm right in saying it's less common in social care, but this dementia is one example where we are trying to encourage some national audit work. In a bit more detail, Quality Statement 4 says that people with dementia are enabled with the involvement of their carers to take part in leisure activities during their day based on individual interest and choice. And a little bit more detail of what that might mean in practice, but as I say, on the website, a lot more precise information. Also on the website, you'll see things that we call pathways. Pathways is perhaps a slight misnomer. They're not exactly what people might describe as a care pathway. They're more NICE's approach to mapping out all the relevant bits of information that we've published on a particular topic. And on dementia, there's quite a lot, because we've got the social care work, we've got health work, and as you may know, we've also done drug appraisals in dementia. So the advantage of our NICE pathways is that they pull all that information together in one place, and you don't have to go hunting around the NICE website. And we're encouraging the guidance development work in social care to think through, where appropriate, how a pathway might be a good way of demonstrating the information. So if you go to one of these pathways and you click on a particular button or node, it brings up relevant information on the right. And the purpose here is to show that this is how we've brought together the information from the health-related quality standard on dementia and the one in social care. So our future social care programme is quite a comprehensive one. It has, if you like, a number of bits, starting with getting the topics right, and I've told you a bit about how we're going about doing that. We then need to develop guidance to underpin quality standards where we don't already have it. The quality standard work follows on, and then perhaps the most challenging bit, communicating that information and getting it into practice. For several years at NICE, I've been responsible for the implementation programme, and I know all too well that although developing guidance isn't easy, getting it used in practice is the hard bit. I mentioned in passing that we had established a collaborating centre for social care to support this work, and that's really important in terms of us getting a resource that understands the social care environment and help us to do this work, following standard NICE methods and processes. It is hosted by Sky, and their component is to develop that guidance following NICE methods, and very much to help us with the communication element and the implementation support. To also help us get this right, because as I say, NICE's background was in health and then public health, we've set up a social care reference group. These are representatives from key social care organisations that come together probably about quarterly, and they've been a very, very useful resource to give us advice on some of the key challenges that we were facing as we were going through setting up the programme. For instance, they helped us look at that initial library of social care topics. They've given us advice on how we might present the guidance in future, how we disseminate them effectively, and hopefully will be very important using their own networks to encourage the use of NICE guidance and quality standards for social care. So when it comes to using quality standards, some people will say that they are there designed specifically for commissioners, and certainly commissioners are an important audience for quality standards, but there are also other important audiences. It's really important that they get out to the people actually directly providing the care, to the people receiving care and services, and perhaps particularly in social care too, where people are often paying for their own care. I think it's really important that we make the information from future guidance and quality standards available in a format that people can access. But when we publish new guidance, it of course looks at what's value for money, and if you're paying for things yourself, it's really important to know what's going to be value for money. And of course, service providers and some care home providers have shown a lot of interest in the quality standards we've published. They're very keen to use them to demonstrate that they are providing high quality care. We are also looking as well for how quality standards fit into the social care world, because there are already a number of quality frameworks, aren't there, in social care, and we need to think about how our quality standards fit in and support things that are already going on in the system. You may be aware of what's on this slide, that in Caring for Our Future it said that the provider quality profile should include information on whether care is being provided in line with NICE quality standards. And as I briefly touched on earlier, there is also a plan to run a dementia care audit to test, as a pilot, to test how well that will work in care homes. There are also other standards already in place, aren't there, particularly around education. We are keen to work with Ofsted because having alignment between NICE standards and the Ofsted inspection framework is something that we've heard quite a lot from a number of different quarters. So, in fact, earlier this week there was a meeting between the Chief Executive of NICE and the Chief Executive of Ofsted to talk, as you can imagine, at a very high level about how this is going to work. It was a very positive initial meeting, and hopefully in future conferences I'll be able to describe more clearly how it's going to work. NICE has worked over the years quite closely with the Care Quality Commission to see how our standards relate to CQC's essential standards. Because they have a social care role, it's quite easy to build on that relationship. But of course, for those of you who have read the recent Robert Francis report on Mid Staffordshire, you'll know that there was quite a lot in there about standards of care. So the frameworks that we were working to are likely to change slightly. And my take on how the recommendations by Robert Francis might impact on standards are described in this slide, and I'm now getting increasingly confident that this is how the changes might actually come about, because there'll be a consultation document, I think, published next week by CQC, talking about how they're going to develop their standards and how that will relate to what NICE does, as well as a number of other pieces of work from CQC. You might or might not have seen this slide before, but it positions NICE's quality standards on the right of a quality curve. So it's setting out what good and excellent care looks like. The CQC's registration standards further down the left as a cut-off of substandard care. And if you remember, Robert Francis described 3 types of standards, which map against what we have at the moment, roughly like this. The fundamental standards that Robert Francis described are further to the left of the curve than what CQC currently has as registration requirements. There's been a lot of debate about where they sit, but that is how they will be set out in this new document. And very fundamental things like needing to be provided with water, needed to be kept clean, needed to be given pain relief. So those are the sorts of things that are likely to be fundamental standards. But Robert Francis also talked about enhanced quality standards and developmental standards. And those will be in future things that we pick up through our quality standards programme. Enhanced quality standards are pretty much what we do already. They're things that commissioners should be thinking about to generate improvement. Whereas the developmental bit, we haven't really covered so much to date. Francis described them as the really cutting-edge things that you actually won't find everywhere. You will see them in some of the sort of innovative areas, and we should think about including those in quality standards in future, although not with a drive to get everybody doing it, but certainly to pick out some of the new innovations and encourage their use. We hope to build those elements in, probably from the programme starting in the next financial year. So my final slide, which hopefully gives us a bit of time for questions, is just to summarise what we're trying to do with our social care programme at NICE is to clarify for people in a clear format what works, and importantly, what is value for money. As the budgets get ever tighter, that's going to be important for all of us. Really key bit about being able to integrate that advice across health and social care. The quality standards will provide a focus on areas of improvement. And because we know that the social care audiences are diffuse, probably more challenging to reach than some of the audiences in health, we need to make sure that we've got the resources right to support that. One of the benefits of working with Sky. So those need to be working with other national bodies, working through local organisations, and importantly, making sure the information is also directly available to service users and carers. Thank you.
Thank you very much, Gillian. Do we have any questions? There's quite a lot to think about in that presentation. Do we have any questions? Oh, great. Gentleman there, and then gentleman there. Can you say your name, where you're from?
Sure. I'm Julian Forder from the University of Kent. You touched on value for money, and obviously NICE is well known and on the health side for commenting on cost effectiveness and cost effectiveness thresholds. Is that kind of methodology one that you will be bringing into social care?
The short answer to that is yes. Absolutely need to build in that cost effectiveness element to the guidance development. We've used that methodology in the clinical work, as you referred to. We've also applied it to public health too. So we've now got quite a broad range of experience in different types of arenas. We're going to need to make sure that we research what we do as we go forward with social care, because I'm absolutely sure it's not going to translate completely across into social care. So we've got a research programme ongoing alongside the work as we take it forward, because I think it is key, as you say, it's part of NICE's raison d'etre, and we need to get it right. The most interesting auditorium, isn't it? Music in the background.
Mike Frizzell from Everycare. When we're checking with our users the quality of our service, we sort of dream up our own questionnaire. It would be useful if you were doing these standards, whether you had like a self-audit tool for us to use with our service users so we can check that we are achieving what's expected?
We always produce an audit tool or an assessment tool, it depends how it's framed, but there's some sort of measurement tool alongside the quality standards. It would be great to get your input perhaps when we are doing the next piece of social care work to make sure it works for your requirements. So.
Hi, do we have any more questions for Gillian? Okay, well...
I feel like we should all be getting up and dancing.
Sorry, I think, do you want to ask another question? Yeah. Okay.
Just moving on to personal budgets in social care. I mean, you talked about the audience for this, and clearly, as you said, there are many people that pay for care themselves, either as self-payers, and increasingly, of course, people who have personal budgets, sometimes as direct payments, which they use as well. So presumably, those people, you would see those people as targets for your guidance in trying to help them in spending their budgets. Is that right?
Yes, absolutely. Because of the personal budgets, as well as people paying out of their own pocket, it's really important that the information is available to service users, and we're aware that in future there will be personal budgets for health as well. So the model that's already in place in social care is going to get rolled out for health. So it's something that we need to get right across a broad portfolio of our programmes.